Good afternoon, and welcome to Covenant's annual meeting with our community. My name is Joanne Malloy. I'm the Senior Operating Officer for the Misericordia Community Hospital. I'm very pleased to be your MC for today's event. On behalf of the entire Covenant family, Covenant Health, Covenant Care, and Covenant Living, welcome. Hey, everybody. Before we begin, we would like to acknowledge that what we refer to as Alberta is the traditional ancestral territory of a diversity of Indigenous peoples and home to Treaty 6, 7, and 8. We honor the Blackfoot Confederacy, Kainai, Piikani, and Siksika, the Cree, Dene, Saulteaux, Nakota Sioux, Stoney Nakoda, and Tsuut'ina Nation, and the Métis people of Alberta. This includes the Métis settlements and the 6 regions of the Métis Nation of Alberta within the historical Northwest Métis homeland. We make this acknowledgement as an act of reconciliation and gratitude to those whose territory we reside on or are visiting. While Covenant Family has been hosting an annual community meeting to gather and connect with one another for many years, things are looking a bit different this year due to the COVID-19 pandemic. To ensure the health and safety of everyone in attendance, we've taken this meeting virtual. It's exciting, and I'll admit, a bit daunting as well. We miss being able to see you and to connect in person over a shared meal. But we're so pleased that you've joined us virtually so we can continue to connect with one another in a meaningful way. This event brings so many of us together from different places, organizations, and sectors. And yet, though different, we are bound by a common mission, a mission of service to each other as spiritual beings, a mission that recognizes the incredible value of building and fortifying connections that encourage growth and foster healing. The past 2 years have reaffirmed for us the importance of connections. It has been a difficult time for everyone. Many of us have lost connections, and the need to connect in meaningful ways with friends, family, colleagues, and communities has never felt more critical. We have also seen how different and innovative ways of connecting can become so important. For Covenant, it is through our connections that we are moving forward with our mission of providing compassionate care, as well as our vision of transforming healthcare and creating vibrant communities of health and healing. That is why we've chosen to focus on the theme of connections for our event today. Across Covenant, we are connecting in many different ways. We are making connections through technology to ensure our patients and residents receive the care and services they need. We are connecting with each other through cross-discipline and site collaborations to support our teams, meet challenges, and continually enhance the care we provide. And we are connecting with our communities, locally, nationally, and internationally, to transform care and to find innovative solutions to challenging healthcare problems. Over the next hour, we'll showcase some of these connections. We hope this event is the beginning of a conversation about how we stay connected, that you will carry forward in your own life and work. We'll share uplifting videos inspired by the theme, and we'll invite you to participate in an interactive poll based on what you see and hear. A number of special guests will join us, some via video and others live here in the studio. We'll also welcome Covenant CEO Patrick Dumelie to share some of the highlights from Covenant over the last year. And our board chair, Ed Stelmach, will introduce a very special award being presented to 2 people who have made significant contributions to Catholic healthcare. We are grateful to have so many Covenant partners join us today. Representatives from the Archdiocese of Edmonton, several congregations of sisters, representatives from the Government of Alberta and Alberta Health Services, and members of our board and directors of community boards. Thank you so much for being here. We are truly humbled and thankful for your support. We have lots to cover, so let's get started. It's time to look at the first aspect of our connections theme, connecting through technology to provide both physical and virtual care. I'd like to welcome John Popowich, Covenant's Chief Quality and Privacy Officer, to give us an overview.
Thank you, Joanne. At Covenant, we are connecting our patients and residents to technology and other innovations to ensure they receive the care and services they need. Our goal is to offer safe, person-centered care that helps improve the quality of life of those we serve, no matter where they are in their health journey. Here are some great examples. Our vascular surgeons at the Northern Alberta Vascular Centre, located at the Grey Nuns, are using Canon technology to perform procedures that are helping to save lives and limbs for people who suffer vascular diseases. The technology gives the surgeons exceptional image resolution, enabling them to see blood vessels that are difficult to see using less advanced equipment. Our breast surgeons at the Misericordia are using the Faxitron, a high-definition imaging machine, to give women undergoing surgery for breast cancer not only better health and cosmetic outcomes, but also peace of mind. The machine can detect whether a patient's breast tissue is free of cancer cells immediately following surgery. This may mean she doesn't need a second surgery, allowing her to move forward on her healing journey. Doctors at the Institute for Reconstructive Sciences and Medicine, based at the Misericordia, are using the latest techniques in reconstructive surgery to rebuild jaws for cancer patients, helping them eat, drink, and speak again, and restoring their dignity. The IRSM is also world-renowned for facial reconstruction, restoring patients' ears, eyes, noses, and other structures, and for technological advances in speech and swallow therapy and healing solutions. We are also using technology to provide virtual care and treatment. Stroke survivors living in rural Alberta are receiving at-home rehabilitation through video conferencing. They are able to connect with therapists in the Stroke Early Supported Discharge program at St. Mary's Hospital in Camrose on Zoom. Use of the technology reduces travel barriers, giving patients more timely access to therapy. During the pandemic, the program has expanded to offer virtual therapy to people who have been diagnosed with long COVID, demonstrating our commitment to be responsive to people's changing needs. We're using technologies such as gaming systems, virtual reality apps, a special television channel, and iPads to address social isolation and help residents in our centers stay mentally and physically active. For example, residents at St. Teresa Place, a Covenant Care Center in Calgary, are using MotiView, a virtual cycling program that allows them to cycle the world without leaving home. And palliative patients at Dulcina Hospice can travel, try new experiences, or revisit meaningful places from their past using virtual reality headsets, enabling them to fulfill end-of-life goals. Moving forward, we are developing a platform for innovators to offer technology solutions that improve the quality of life for seniors and help them continue living in their communities as they age. This work, along with our partnership in the Courage Initiative to reimagine seniors' care in Canada, will inform the technological solutions we are building into the Covenant Wellness community in Southeast Edmonton. The wellness community will offer person-centered holistic care with clinics, doctors' offices, lab services, and other health providers under one roof. Our first video explores our innovative solutions and our commitment to providing care and services for our patients and residents. Let's take a look.
Technology, a powerful and transformative force in our world today. It helps change the lives of the people we serve. These advances provide opportunities to improve healthcare in ways that not so long ago were unimaginable. At Covenant Health, we are connecting our patients and residents to innovative technological solutions that enhance the services, supports, and programs they need. Technology that enhances care and treatment physically, virtually, and holistically. We connect those in our care with cutting-edge technology at our urban sites and also at our rural facilities. We utilize technology that enhances the healthcare experiences of patients requiring acute care, as well as for those who look to us for long-term care solutions. As we look to the future, our quest for innovation leads us to exciting new projects. Our partnership on the Courage Initiative aligns us with a national movement that is building unique strategies to help older adults live at home as they age. Our newly developing Seniors Innovation Platform will act as a living laboratory for designing, testing, and adapting technology to support seniors living at home. Our innovative work will inform the strategies used for integrating advanced technological solutions into the new Covenant Wellness community. The first of its kind in Alberta, the wellness community will offer Albertans a one-stop wellness destination that provides integrated and holistic community-based care. By connecting our patients and residents to the transformative power of technology, we are carrying on our mission of providing compassionate care. Our teams will continue to use technological innovation to drive transformation in the healthcare system, improving the lives of those we serve and beyond.
Thanks, John. What an inspiring exploration of how connection through technology is bringing health and healing to patients, residents, and families. I'm pleased now to share this important message from Archbishop Richard Smith.
Hi, everybody. Glad to have this opportunity to join with you as you gather once again for the community meeting. Love the theme, connections. And it inspires within me a desire to say a heartfelt thank you to all of you. You have done so much to ensure meaningful, helpful, life-giving connections with people, especially at a time in these last couple of years when so many of those connections between loved ones just wasn't possible because of the pandemic conditions and so on. But you were right there, making the connections that made such a difference for people. And it's something that we need to continue, obviously. And what I would encourage is that as we're reflecting upon the theme of connections, we strive to connect deeply, very, very deeply with our tradition. Our tradition as a Catholic health care family, a deep tradition of compassionate, loving care for those who are ill, for anybody who is in need. A tradition that connects at its origin, of course, with the gospel that announces Jesus, in whom God is connected with us. In Jesus, God's mercy, God's love, God's compassion connects with humanity. And through Jesus, and now through us, as members of his body, as members of a community of people that want to serve in his name and carry on his ministry, that connection continues. So thank you for what you do, and let's look for new ways in which the connections can continue and deepen. Best wishes for the gathering, and I hope it's meaningful and helpful to you all. God love and bless.
Thank you, Your Grace. Also sending greetings to our gathering is Alberta Minister of Health, Jason Copping.
Hi, I'm Jason Copping, Alberta's Minister of Health. Thank you for asking me to be a part of your annual community meeting. Unfortunately, I cannot be there in person, but I'm pleased to participate virtually. First and foremost, I want to say thank you for your tremendous dedication in providing healthcare to Albertans. Thank you to those working on the front lines. Thank you to the Covenant management team, and thank you to everyone who is part of the Covenant Health family. It's been an unprecedented time of difficulty for Alberta's health system, and indeed health systems across our entire country as we battled the COVID-19 pandemic. At times, it has seemed unrelenting, but when COVID pushed us the hardest, you pushed right back, fighting to protect Albertans. I extend my deep appreciation for your efforts, dedication, and sacrifices, and most importantly, your unwavering commitment to providing high-quality, compassionate care to Albertans. The theme for your meeting, Connection, was well chosen. These challenging times have reinforced the importance of connections in providing compassionate care and creating vibrant communities of health and of healing. As we look to the opportunities and challenges in the weeks ahead, I'm confident you will continue your terrific work, doing everything possible to improve the health system and providing compassionate care, health, and healing for all Albertans. Thank you again for the high quality care you provide to those you meet every day, both to patients and their loved ones in some of the most critical times of their lives. Enjoy your meeting.
Thank you, Minister Copping, for your ongoing support of Covenant and those we serve. Our board chair, Ed Stelmach, is a true champion of the Covenant family. He provides valuable counsel and ongoing support to our leaders and teams as we do our work. We're grateful to have him join us live in the studio today and to introduce our Service Through Christ Award. Mr. Stelmach.
Thank you, Joanne. Good afternoon. It is a pleasure to bring you greetings today on behalf of all of my colleagues on the Covenant Health Board. Thank you, Minister Copping, for your kind words. On behalf of all of us, we are grateful to the Government of Alberta for entrusting us with the work we do and are so pleased to include greetings from you in our gathering today. Thank you, Archbishop Smith, for your encouragement. We are grateful for your support as we carry forward the legacy of Catholic healthcare in Alberta and across Canada. We also have representatives from several congregations of sisters joining online this afternoon. Thank you for your trust in us to carry forward your legacy of Catholic healthcare, for your unwavering encouragement and your constant prayers. We also have members from a number of foundation and community boards across Alberta attending online. I'd like to acknowledge them for their hard work, for all the hard work they do in their communities, and for the tremendous wisdom and advice they offer our board and senior leaders. As many of you may remember, Covenant was not able to hold its annual community meeting in 2020. The event was canceled because rising cases of COVID-19 made it challenging to gather safely. We also wanted to acknowledge the demands the pandemic was placing on our staff and physicians. There is no doubt the last 2 years have been difficult. Our teams are still facing the challenges and stress of caring for patients who are critically ill with the virus and of keeping our residents safe. We're also dealing with other challenges brought on by the pandemic, such as managing surgery backlogs, meeting increased needs for mental health support. At the same time, the creativity and innovation our people have shown in response to the pandemic, as well as their commitment and dedication to patients, residents, and families, have been truly inspiring. Our board and senior team are so proud of how everyone has come together as one during the last 2 years, supporting each other and continuing to provide compassionate health care. I'm also pleased that connections is the theme of the Covenant Annual Community Meeting this year. An opportunity to showcase how Covenant is using new leadership, new technology collaboration, and community partnerships to fulfill its vision to transform care and create communities of health and healing. This is an important theme that honors our roots and the important work of our founding sisters. The sisters were visionary women who found new and creative ways to meet people's needs during times of hardship and who valued collaboration and partnership in supporting those in their care. We are guided by their legacy of innovation, resourcefulness, and compassion. As a board, we work collaboratively with Covenant leadership to set the direction for the organization in support of its strategic plan. In keeping with our efforts to continually improve, we have defined 3 important areas of focus for the organization in making a difference for Alberta. A focus on the patient journey, innovation, and partnerships. Our discussion today will support these efforts as we continue to explore opportunities to connect our patients and residents to innovative technological solutions that enhance their care, to work together to address challenging healthcare issues, and to partner with others to bridge gaps, address unmet needs, and bring those at the margins into the community. The COVID-19 pandemic has had a significant impact on our healthcare system and has brought unique and unprecedented challenges to how we do our work. But our Covenant teams have responded as they always have, with an unwavering focus on the health and well-being of those we serve. Across the Covenant family, we are called to serve with compassion, uphold the sacredness of life in all stages, and care for the whole person. This is our mission, and never has it been so alive. It is what has helped us through all the difficulties and stress of the pandemic, giving us hope, determination, and the physical and mental strength to continue meeting the needs of Albertans. I am grateful to our Covenant teams for answering the call to serve during this challenging time. My heartfelt thanks go out to each and every Covenant staff member, physician, and volunteer for all you do. As always, at Covenant, we look to the future with the awareness of our place in the present and with an eye on our past. Like our founding sisters, we are making meaningful connections to care for our patients, residents, and families as whole people. Like them, we strive to serve, contribute, and transform, responding to the everyday needs of communities and reaching out to those who are vulnerable and underserved. We constantly strive to find new, more sustainable, and effective ways to provide high-quality care supported by partnerships with patients, residents, communities, government, and other healthcare providers. And we are mindful to never lose sight of the reason we do what we do, our patients and residents. Their care is always at the forefront of our thoughts and actions. Each year, we honor people or organizations who have carried on the sisters' legacy and made a significant contribution to healthcare through the Service Through Christ Award. Award recipients are selected by the Covenant Board for their outstanding contributions to Catholic healthcare, regardless of faith affiliation, and who are an inspiration to others. Please join me in learning more about this year's recipients. Good afternoon, everyone. My name is Ed Stelmack, and I have the pleasure of chairing the Board of Covenant Health. And on behalf of all of the board, I wish to welcome everyone to this very important presentation.
The Service Through Christ Award was established in 2011 following the establishment of the statute in the legislature grounds. And that event was both a look back at the historic contribution of the sisters' work in Alberta, but we knew at the time that it was also intended to showcase and inspire others to follow, like the sisters, in their footsteps and responding to the needs of our day. And that's why the award was established, and it's an opportunity for us to lift up individuals in our community today who are demonstrating that service through Christ.
I'm Karen McMillan. I'm the Senior Operating Officer for the Grey Nuns Hospital Covenant Health. It is my great pleasure to announce Gail Cameron as the recipient for the 2021 Service Through Christ Award. Gail was the Senior Director of Operations for Women's and Child Health until she retired in 2021. She is a pioneer, and under her leadership, the Grey Nuns was the first hospital in Alberta to close its newborn nursery. She promoted a family-centered care model that emphasized providing evidence-based care and fostering family unity while maintaining patient safety. Gail worked collaboratively with her team to bring her vision of the program for Grey Nuns to life. And they grew it from delivering approximately 1,500 deliveries a year to over 6,000. As an advocate for skin-to-skin kangaroo care, she promoted a collaborative care model between labor and delivery, postpartum, and the NICU at both the Grey Nuns and Misericordia hospitals. The maternal methadone use and neonatal program was developed to support vulnerable mothers and newborns, giving their moms an opportunity to provide care to their newborns in a supportive environment while being treated with dignity and compassion. Gail created the Foster Care Clinic, which provides a holistic medical home and trauma-informed care for vulnerable children who have been removed from their biological families. She was instrumental in creating the Angel Cradle programs at both the Misericordia and the Grey Nuns hospitals. This program is a safety net for parents who are at risk of abandoning their newborns. Gail has continued the Sisters' legacy of compassionate care and service. She has worked to support the most vulnerable in society. She is an inspiration. Congratulations, Gail, for receiving this well-deserved honor.
Hi, I'm Gordon Self, Chief Mission and Ethics Officer, and I'm delighted to share that Dr. Fred McDonald is one of our recipients for the Service to Christ Award. His lifelong commitment to Catholic healthcare is demonstrated by his leadership and governance roles. Fred served as medical advisor, clinical head, and medical director roles, including board appointments to both the Grey Nuns Hospital and St. Joseph's General Hospital in Vegreville. Dr. McDonald retired in 2014. Dr. McDonald's leadership is demonstrated in his pioneering work in pulmonary medicine. He designed the first intensive care unit in Edmonton in 1971. In 1982, he established a Center for Lung Health at the Edmonton General, including the Breathe Easy program, which provides respiratory and rehabilitative care for thousands of Albertans. The center is now called the G.F. McDonald Center for Lung Health. Dr. McDonald was instrumental in extending pulmonary rehabilitation care to many Albertans living in remote areas of the province through telehealth, which, although commonplace today, was a pioneering step forward. Dr. McDonald embodies visionary leadership and always saw the dignity of the person living with pulmonary illness, but not being defined by it or limited by the disease. As healthcare increasingly becomes more technical, his patient support and encouragement reminds us that each person is a human being, created in God's image and likeness, and worthy of profound respect. Please join me in congratulating Dr. McDonald for receiving this award and being recognized for his contributions.
Sorry I can't be with you today, but I'm grateful through video and technology I can join in. I want to congratulate you both. I feel honored and privileged to have worked with both of you for many, many years. I can tell you that you both personify what it really means to live the mission of Covenant. Both driven and passionate leaders with vision and commitment. And that service that you've provided has touched so many people. But more importantly, you've laid a path, a foundation, which others are now taking up the torch and leading in the same way that you've taught them. So I really want to thank you on behalf of all of us for your commitment and your leadership. I cannot think of two more deserving recipients. So God bless both of you, Gail and Fred, and hope to see you sometime soon.
Thank you, Ed, and congratulations to this year's award recipients. It is my honor now to introduce our Covenant CEO, Patrick Dumelie, who is here with us today in the studio to share some highlights of our work over the last year and some thoughts on what's ahead. Patrick?
I couldn't be with Gail and Fred when we handed out the awards, but I am here today, so happy to be with you here today. Partners, supporters, leaders, staff, physicians, community members, all of you who inspire us and work with us to live our mission. Thank you for your continued support and partnership in making Alberta's integrated health system strong, responsive, and sustainable. I also want to thank Health Minister Jason Copping for not only his kind words, but his leadership and support. We are so grateful for the Government of Alberta for entrusting us with the work we do every day. I also want to acknowledge the many representatives here from Alberta Health Services with whom we collaborate every day to improve the care we provide our patients and residents. Thank you for your continued support and partnership in making Alberta's healthcare system strong, responsive, and sustainable. It's obvious that much has changed since we gathered in person at our annual community meeting. So much of our work and the way we connect have changed. Instead of a shared lunch, as we would traditionally do, we connect across the computer screen. While we still need to do that to remain safe and healthy, it's more important than ever that we find ways to connect with each other, to strengthen our partnerships, and to continue the work of transforming healthcare for those we serve. I'm so glad that you've joined us today. As Ed noted, COVID-19 has taken its toll on us all in the last 2 years. But one thing that I'd like to stress that has not changed is our enduring mission of compassionate care. If anything, the pandemic has strengthened our call to serve and reinforced our shared commitment to quality care and innovation. I'm so proud of the way we've rallied together, always doing what has been required to keep the people safe and to provide the care and service that people have needed. The Covenant family is made up of more than 15,000 staff, physicians, and volunteers. We come from many different backgrounds, and the diversity is a great source of strength as we serve people from different walks of life with different needs and circumstances. One of the things that we have in common is a shared and deep commitment to honor the inherent dignity of each person as we live our calling to serve, providing safe quality care, body, mind, and soul. As always, take great strength from the legacy of our founding sisters. They led Catholic healthcare for people through economic depression, through drought, through Spanish flu, and even war. The sisters taught us and have given us a tradition that we really personified and lived in the past couple of years, and for that, I couldn't be more grateful. Our strong mission-inspired culture at Covenant is among the reasons that we were recognized one of Alberta's top employers and one of the world's most ethical companies in 2021. And we remained one of Canada's most admired corporate cultures. This really speaks to the values we all share and how we bring them to everyday life. Whether it's providing care at the bedside, driving innovation and quality improvement, or setting strategic direction around a board table, Covenant Vision calls us to create vibrant communities of health and healing. I'd like to share with you just a few ways we've been doing that in the past year and how we will continue to transform and grow in the months and years ahead. It's appropriate that the theme of today's event is connections. We recognize the importance of making meaningful connections to support the physical, emotional, spiritual well-being of our patients, residents, families, and each other. A number of recent initiatives and projects demonstrate this. Over the past year, we've been working with communities within our organization to advance diversity, equity, and inclusion. This includes developing a plan and an approach to acknowledge and address racism at Covenant and engaging our Indigenous communities to establish long-term positive relationships. While working with our Indigenous advisory body, we honored the National Truth and Reconciliation Day in Canada by offering opportunities for reflection, education of our staff, physicians, and volunteers. We also have clarified that our mission calls us to end discrimination based on sexual orientation or gender. I had the opportunity to host open conversations with staff to explore meaningfully the ways in which we can ensure that our LGBTQ2S+ colleagues, patients, and residents feel safe and valued. Throughout the year, we also continue to make meaningful connections with patients, residents, and families through our Patient, Resident, and Family Engagement Program. Volunteers in the program, who we called Covenant Partners, are essential to helping us provide care that is safer and better informed and that improves healthcare experience and outcomes for all. We collaborated with several agencies in the Catholic community to establish YEG Sparks, an innovative and engaging program which included Edmontonians in the midst of COVID-19 pandemic, providing opportunities for volunteerism in a web-based platform. These opportunities the opportunities to use creative gifts and expression and support older adults, patients, and hospitals during those times where people are experiencing homelessness and risk and other people struggling during the pandemic. During the year, we embarked on an exciting partnership with SE Health, St. Elizabeth Health in Ontario, on an initiative that we are calling Courage, Action for Better Aging. Together, we are facilitating a national dialogue about mobilizing action to ensure Canadians can age in their homes and communities with quality of life, choice, and independence. In the clinical arena, we connected with the Network of Excellence in Seniors Health and Wellness and TELUS on a pilot project to evaluate the benefits of transitioning older adults with persistent mental illness from receiving care in the community to a home-based option. Its success was affirmed the viability of the telehealth approach as a sustainable care option for our community geriatric psychiatric program. Another major initiative for the Network of Excellence in Seniors Health and Wellness over the past year was the continuation of grants to augment dementia care solutions in rural long-term care. The funding provided the opportunity for facilities to implement site-specific innovations that are also pragmatic. 2 Covenant Health sites, Our Lady of the Rosary Hospital in Castor and St. Mary's Healthcare Center in Trochu, received grants to provide dementia education for all site staff. Also in the area of continuing care, we worked with the community members and residents to co-design our Killam Campus of Caring. The 50-suite long-term care campus supports all levels of care so that residents can remain connected and do not have to leave their community and their loved ones to get the care they need. This campus includes couple suites, so couples, some who've been together for decades, can continue to share their homes and lives even as their care needs change. We also worked in partnership with community partners in Lethbridge to develop a new 102-bed home for seniors with a mix of designated supportive living spaces, including supports for people with dementia. The 3-story home will be purpose-built with many special features to enable seniors to remain independent and active and maintain their connections to their friends and family. Over the past year, we've also made significant progress on redeveloping the Misericordia Emergency Department. The new ED will include a state-of-the-art training lab we are developing with Alberta Health Services as part of the eSIM Provincial Simulation Program. The lab will provide opportunities for clinical educators to deliver interactive educational programming for healthcare workers using specialized simulation equipment. Construction of the new ED is under full swing if you've been by there, and the project is both on budget and scheduled to open in 2023. Looking to the future, we have a bold and innovative plan to help people and families stay connected and healthy in their communities. We've recently announced the work we are doing in collaboration with Rohit and a number of other partners to create the wellness community on our Southeast campus. Supporting Alberta's economic recovery and community revitalization, the community will include affordable housing, seniors housing, a community health center, office, and retail space. It will serve as a one-stop wellness destination for a commercial and service hub to become an important economic and health center in Edmonton. And a model of innovation and integration and sustainability that would be a prototype for the province. Construction of Phase 1, the Community Health Center, will begin this summer. Some people have referred to COVID-19 as a pandemic pause. In the last 2 years, there have certainly been aspects of life that we've slowed or even put on hold. Yet at Covenant, our innovative and transformative work has not stopped. In fact, we've taken the time to create a bold innovation plan that will allow Covenant to increase its strategic contribution to the province and those we served. Inspired by the tenacity and creativity of our founding sisters and guided by our shared values, we've continued to serve, contribute, and transform in a time of real challenge and difficulty. Looking ahead, we know that COVID-19 will be with us for some time, and we need to continue to be vigilant and to ensure that we have the capacity to serve. But we see a bright future for our province, for the people we serve, and for Covenant. Our mission could not be stronger. We are resilient, and we are committed, and we carry the lessons that we've learned over the past 2 years with us. The commitment, compassion, and passion we see in our people are keys to our success and to fulfilling our vision of transforming communities of health and healing. I look forward to this bright future, a future filled with hope. Thank you again for attending our ACM today. We are grateful for your ongoing support and partnership, and God bless and be safe.
Thank you, Patrick. We clearly have much to be proud of as an important partner in Alberta's healthcare system and as a leader in transforming healthcare in our province. And now it's time for the second part of our theme exploration, connecting through collaboration to support those we serve and each other. I would like to welcome Karen McMillan, Senior Operating Officer for Grey Nuns Community Hospital, to introduce this segment.
Thank you, Joanne. At Covenant, collaboration is one of our 6 core values. We connect to solve challenges, provide high-quality, compassionate care to our patients and residents, and support each other. We know that when we work together, we can accomplish more, achieve higher quality results, and come up with more unique ideas. Collaboration has been especially important over the last 2 years. We have come together in unprecedented ways, blurring the lines between roles, positions, units, sites, and even organizations to find solutions to the challenge of the pandemic. And our teams have met these challenges with creative, warmth, humor, and unwavering compassion for the people we serve and for each other. For example, physiotherapists at the Misericordia Community Hospital were redeployed to provide respiratory therapy within the site. Emergency room nurses and pandemics and nurses from other areas in the hospital stepped up to work in intensive care unit at the Grey Nuns Hospital. At St. Mary's Hospital in Camrose, the diagnostic imaging team worked with the environmental services team to meet increased cleaning protocols. Teams at our long-term care sites work together to keep our residents connected to their families and friends by facilitating virtual visits through iPads and other devices. And our staff at Covenant Care and Covenant Living sites collaborated to ensure supported and independent living residents kept active and engaged through innovative recreation programs using virtual reality technology and other tools. Covenant teams have also worked with teams from Alberta Health Services to ensure COVID-19 regulations and orders were communicated and up to date, to develop tools and resources for frontline workers, and to provide education and training in COVID-19 protocols and processes. We have had to be intentional about our connections and to make connections in different ways. Going forward, we know the future of our work and the workplace is going to look different as well. The workplace will be less about physical buildings and more about creating conditions for people to be successful. We are visioning the conditions that will help our people do their best work, connect with each other, and thrive. Our next video looks at collaboration through interviews with representatives from our physician, our senior leadership. Let's see what they have to share with us.
Collaboration is key. It's key to everything we do in healthcare, and you very clearly recognize how important it is. If you don't recognize it going in, you will figure that out very soon into your career as a healthcare provider. We need the different viewpoints, we need the different voices, we need the different expertise that we get from collaboration. Covenant has always been about how do we work in the community, how do we be good neighbors, and this is just another example. Hey, this works for us, why don't you try it?
We're a large organization and we have lots of expertise, and not all other organizations have that depth and breadth of expertise, and then that's a great way for us to share the value that we have within Covenant Health.
The pandemic has really, I think, highlighted the need for collaboration, has really enforced for us how valuable it is. At the beginning, I think we lost a little bit, and we very quickly realized that collaboration is not only essential, it's more essential in the pandemic environment. And it has led to a whole lot of creativity and innovation. How do we connect? Can we use technology in better ways? It's really allowed us to connect with our patients, I think, in ways that we weren't able to before. I see patients reaching out in different ways, sharing information, becoming increasingly part of the team, which has always been what we wanted, but I think now we really see the power in that collaboration.
Nobody in our workplace works in isolation. Everybody is part of the bigger picture of how the organization is successful. So paying attention to those connections and leaders supporting our teams to stay connected is how we'll all be successful.
I think when it comes to sharing what we've learned and sharing our knowledge, what I have found is we're connecting more with people that we normally wouldn't have connected, and we're understanding what value other people have and expertise they have, and you learn from them.
We've been through so much over the last few years, and I think we really need to understand people's experiences. What have they had to deal with over the last 2 years? And it's different across all of our workers. From the people that have been in the clinical areas to people who have worked, hybrid. Some have been in and out of the office, others that have been completely remote. Everybody's experience has been different. So we need to think about what that means for people looking to the future of the workplace. So what has disconnected people, and how do we make those connections again between people so we can move forward together?
In healthcare, I think what we're going to see is we're going to continue to see a melding of in-person and virtual care. Fundamentally to that is keeping that patient in the center of it. Is it better for them to access us remotely, or is it better for them to come in? And just remembering that that's key to those decisions we make.
Thank you, Karen, and the interviewees who spoke about collaboration. It is heartening to hear how teams have come together to meet challenges, enhance care for our patients and residents, and support each other. Thinking about what you've just seen and heard, we would like to invite everyone to participate in a poll. Here is the poll question. How have you made meaningful connections in the past year in your work or in your personal life? Thank you, everyone, for participating. Here are your poll results. It's clear from your poll choices that connection is essential for all of us, and that we have all found ways to make connections that are unique, meaningful, and impactful. Whether newfound or already established, we hope your connections continue to be a source of strength and inspiration for you. We've now come to our third theme exploration, connecting through community partnerships to transform care and find innovative solutions to healthcare challenges. I would like to welcome Lynn Klein, Senior Director Operations for the Edmonton General Continuing Care Centre, to introduce this video segment. Lynn.
Thanks, Joanne. At Covenant, we connect with communities locally, nationally, and internationally to fulfill our mission of providing high-quality, compassionate care. These collaborations are vital to achieving our vision of transforming health systems. Our partnerships are helping address unmet needs, bridge gaps, and meet challenges that impact the quality of life, health, and well-being of people in Alberta, across Canada, and around the world. We value our partners for the insights, resources, and expertise they bring to our responses to challenges and emerging trends. A local example is the work we're doing with members of communities within our own organization, such as our Indigenous and LGBTQ2S+ communities, to address issues of diversity, equity, and inclusion. We're also working with patients, residents, and their families through our Covenant Partner Program to ensure they have a voice in their care and to improve healthcare experiences and outcomes. We rely on local community boards connected to our sites to help us determine the future of Catholic healthcare in key areas of need, such as palliative care, seniors, mental health, and rural health. For example, our work with the community in Killam led to the co-design of our new Killam Campus of Caring, a unique care model that offers supportive living, long-term care, and dementia care under one roof. The model empowers residents to age in place as their needs evolve. We also partner with various volunteer groups, businesses, and organizations to enhance the care we provide at our centers. Over the last year, we worked with TELUS to provide live stream technology for recreation therapy activities and entertainment for our residents at St. Teresa Place in Calgary and other Covenant care sites. We have collaborated with staff from the Public Library in Edmonton to provide families with babies in the neonatal intensive care units at both the Grey Nuns and Misericordia hospitals with book packs. Library staff have also visited long-term patients and patients in our mental health units to share stories and music, helping to reduce social isolation and providing opportunities for interaction. In 2021, we also partnered with Horizon Networks, a teen volunteer group in Ontario. The teenagers connected with residents at Evanston Summit, our Covenant Living site in Calgary, to play Jeopardy over Zoom. We have connected with individuals, groups, and organizations across Canada and internationally to build networks, affect public policy, and reimagine care for vulnerable populations. Working with SE Health on the Courage Initiative, we are bringing people together to explore ways to help Canadian seniors age in their own homes and communities. On the international level, the Institute for Reconstructive Sciences in Medicine, a joint initiative between Covenant, the University of Alberta, and Alberta Health Services, is training surgeons from all around the world in the latest and most innovative methods of rebuilding jaws for cancer patients. Our next video features some of these partnerships through interviews with staff, physicians, volunteers, and community members. Let's have a look now.
I think when we have diverse partnerships with the community, with academic institutions, with faith groups, with businesses, it just opens us up to new ideas. It opens us up to hear about the whole life experience of our patients and residents and what's especially important to them in their care. And I think it just goes back to we are not a silo. We cannot achieve health and healing in isolation, though we need to work together to provide the best care.
I was a patient myself for longer than I ever thought I would be. Sharing these perspectives enables staff to reconnect with purpose, affect change, and understand the impact of their care. It highlights the significance of the emotional connection of everyday activities. Stories elevate the patient, resident, and family influence for positive change in healthcare.
SE Health has worked with Covenant on a number of initiatives, but when the Courage initiative came forward, we were both so aligned because we're all about people, caring for them, and making sure that the future will be better for all Canadians who are aging in this country. It is critically important that we all work together because not one person or one organization can make a dent in what we're trying to change.
It is important to share knowledge and with others and to support healthcare elsewhere as well, because that is the Canadian way. IRSM stands for Institute for Reconstructive Sciences in Medicine. IRSM is not about one person. It is a team of individuals coming together in the management of these very complex patients, especially in the head and neck region. The patient is in the center. We're all sitting around the patient and we're talking about this patient's management with the patient. That is what we want to be doing here, and that is what we have been doing here. And that can only happen if we collaborate.
One of the ways in which we are establishing these connections within our organization is through advisory bodies. And advisory bodies are when we invite groups of people that have a common background, common experiences, to come together in a safe place and come up with ideas, help identify gaps and opportunities, and help inform the organization of how to move forward with more inclusive practices. The Covenant Indigenous Advisory Body has been instrumental at advancing Indigenous awareness and engagement at Covenant through educational modules, in-person training, through sharing of culture, educating about history, informing team members about health disparities that exist, and those voices are so important to be heard within our organization. So we want to continue engaging different groups so that those voices become normalized throughout our organization and they're heard at all different levels when we're making decisions. This will ultimately lead to better patient outcomes, better business decisions, and less stereotyping throughout the organization.
Thanks, Lynn, and thank you to everyone who spoke about partnerships. We are all grateful to our local, national, and international partners for sharing their insights, resources, and expertise in response to healthcare challenges. Our time together is drawing to a close. Thank you to our speakers and video presenters for helping us explore our theme, and to you for your participation. We hope that this presentation has prompted you to think about the ways you, your colleagues, community, or organization are connecting to make a difference for each other and to those you serve. Together, we can create vibrant communities of health and healing. As we leave here today, I invite you to continue to connect with our work and mission, encountering people from our organization, communities, and beyond who have insights and ideas to share. As you head off to continue your day, please know we are grateful that you took time to join Covenant at this virtual ACM. I hope you found the time valuable and that you leave here with new ideas and perceptions. If you would like to revisit today's presentation, including the Service Through Christ Award ceremony, you can find a full recording posted on our 2021 annual report website at www.covenant2021ar.com in the next few days. Thank you for your ongoing encouragement, support, and belief in the Covenant family. We look forward to seeing you again next year. Thank you, and have a great day. Good to see you all, sitting at your desks.